Hi, my name is Diana Salinas, and I am the Hidalgo County Wellness Program Coordinator. Today, we are interviewing Dr. Maria Madrid from South Texas Health Systems, and we're discussing cholesterol, how it affects your body, and some of the comorbidities that go along with it. If you enjoy what you see here today, we ask that you please subscribe to our Hidalgo County Wellness Program YouTube channel, and I hope you enjoyed today's video. Thank you so much for joining us today, Dr. Madrid. We're going to be talking about cholesterol and hyperlipidemia. So just to start off, what is cholesterol?
Thank you for having me, first of all. It's a pleasure to be here. So cholesterol is a waxy substance, and it's a basic building block for building vitamins, building hormones, and building up our cell membranes. Mm-hmm. So it helps promote our wellness.
Awesome. And what exactly does that affect within the body?
So cholesterol is made, we get cholesterol from two sources. Our body makes cholesterol, the liver makes cholesterol, mm-hmm. and we get it from animal products. So it can affect the liver in excess amounts. And then we have to look at where the blood transport cholesterol everywhere throughout the body. Mm-hmm. And so it can have ending effects in the organs where it's getting transported to.
Oh, okay. Are there different types? So there's different types of cholesterol, like you were mentioning, for the hormones and for other like cells within the body. So exactly like are there different types, and maybe is one like better or worse than the other?
So cholesterol is broken down into LDL cholesterol and HDL cholesterol. We also have a separate group of fats called triglycerides, and that is what I look at in a family practice office. So LDL, low density lipoprotein. It's very dense, very heavy, low. So L for low density. We want it to be as low as possible. So that's generally seen as the bad guy, right? Again, we want it as low as possible for health reasons.
Right.
And then there's the HDL, high density lipoprotein, and H for high is in the name. And we want that one to be as high as possible because that's the one that helps protect your body. So the HDL is the good cholesterol, LDL is the bad guy, and triglycerides is a separate form of fat. Also in excess is a bad guy.
Okay, yes, I know I've heard whenever, my stepdad was going to get his cholesterol checked, they wanted to make sure that the HDL was that high, the better number. So wanting to keep those LDLs down. So that's good numbers to keep in mind. So can you break that down a little more? So we know that there's HDLs, LDLs, and triglycerides. What exactly are their relationships with cardiovascular disease?
So we kind of need to look at the function of HDL. HDL works by kind of like a vacuum. It'll pick up all, some bad cholesterol, takes it back to the liver, where the liver then should break it down, and then it leaves the body. And that's why HDL is the good cholesterol, because it'll sweep up the bad guys, the LDL. So if HDL is getting overloaded, then we're gonna have excess amounts in the blood vessels. So then blood vessels start getting what's called a plaque. And if you think about the plumbing in your house, the plumber, a sink gets stopped up. Call the plumber, he takes out a pipe, and around the edge of the pipe, around the edge of our blood vessels, is where the LDL starts getting deposited, and it forms that plaque. So blood vessels can get affected, and then if the blood vessels get blocked, then we lack blood supply to those organs. The blood vessels in the heart and the brain are very, very small, so it doesn't take a lot of plaque to block those, and that's what triggers heart attack or stroke, or can be a precursor to heart attack or stroke.
Okay, interesting. And so just to say more a little bit about cardiovascular disease, what exactly or how exactly would that affect, someone's body, or, how they can, go about their lives from then on once they start collecting that plaque buildup in their arteries? Or arteries?
Yes,
Yes,
arteries.
okay.
Yeah, so arteries have the oxygenated blood. Arteries take the blood supply to the organ, to the tissue that it needs to go to, and that is where the cholesterol is traveling. And so cardiovascular, we look at cardio, heart, blood vessels. Vascular is blood vessels. So we're looking at heart, blood vessels, brain. Over time, we talked about earlier that the plaque can get deposited on the walls. And there's two ways. So a complete blockage would be we're not getting that blood supply to the heart.
Right.
Okay. Or to the brain. Another form, especially in the brain, is where a plaque gets ruptured. So a piece gets broken off, and that piece goes, and that is one of the forms of stroke. So that piece starts traveling, and then in the very, very small blood vessels, or where the artery splits off, that's where it gets stuck, and then that part of the brain doesn't get the blood supply. So it's a form of blockage, but it's two different ways of blocking. So the plaque can be so thick that it blocks, or the plaque can rupture, and down the road is where the little piece that breaks off causes a blockage.
Okay, interesting. I love this deep dive into the body. I feel like we're on an episode of Magic School Bus, and we're taking a ride through the arteries. So
you're taking me back to my medical school days.
Yes, no, this is great. So if somebody does have high cholesterol, what can you do? And that would be the LDLs. So what can someone do to lower that LDL level, that bad cholesterol?
So a patient comes in to see me, depending on risk factors, which we'll probably get into in a little bit. We do lifestyle modifications.
Okay.
So we look at your lifestyle. What are you doing? How are you eating? And are you exercising? Are you active? And that's where I start. So we want to start with physical activity, generally about 150 minutes a week. You can split that up, take 10 minutes out of your lunch break and take a walk around the building. You could do 30 minutes a day. You can do all 150 minutes in one day if you have the time. But generally 150 minutes a week with a goal in about 6 months of losing 10% weight, which isn't a lot. It isn't a lot. Again, everybody is different, so we look at their weight. And so we form a plan. We look at, eating habits as well.
So foods are important, right? Okay.
Someone who eats out every single day, there's a lot that we can change there. Someone who is already eating at home, fruits and vegetables, and then we're going to have to look at some other options for that person who has high cholesterol. Right.
So if you can elaborate a little more on maybe the specific types of foods that would lower those LDL with the bad cholesterol, would it be, specifically like increasing vegetables, or does it have to do with protein or carbs, or how would that affect the body?
Okay. So we want to look at where we're getting our cholesterol from first, where we're getting the excess amounts of cholesterol. Our liver makes it, like we talked about in the beginning, and then animal products is where we get more cholesterol from, the excess amounts. Red meat is one of the big causes of high cholesterol. In our Mexican culture, the men want their meat and potatoes, and so it's meat every single day. We want to look at getting leaner cuts of meat, 96% lean ground beef, or if you're looking at red meat, one of the prime choices that you have behind the counter, where you have to talk to somebody and ask for a good cut of meat. So animal products, we're looking at dairy products as well. Milk can produce cheese as well. So milk products, dairy products, where you want to look at getting 2% or skim products.
Okay. So not that full
milk,
fat milk, right?
Exactly. And then cheeses from the part skim or 2% milk fat.
Okay.
And
Awesome.
so, I'm sorry, I didn't
No,
mean to interrupt. So we're looking at avoiding, because animal products bring more cholesterol into our body, we want to avoid those as much as possible. There are some meats that are better. Turkey is obviously better. Poultry, any poultry, so turkey, chicken, but we want to be careful with the egg yolks that come from the chicken. Egg yolks have a lot of cholesterol.
Okay.
Doesn't mean you can't eat them. It just, you shouldn't be eating 3 or 4 eggs every single day.
Right. Or maybe the egg whites.
Yes.
Right.
Take out the yolk and you can have the egg whites.
Okay. So those are some really great foods that can, help us lower the cholesterol. So eating, like you were saying, lean meats. If you are going to be eating red meat, make it like the leanest as possible, as well as maybe taking out the yolks from the eggs if you love eggs for breakfast. So that's awesome. Especially, I know in our culture, we tend to love a good barbecue with fajitas and ribs and everything. So maybe making those choices to grilled chicken, or even just kind of, I'm assuming, like, it's good to even start integrating those foods into a barbecue, maybe other than completely removing, like, let's say, all of the red meat at once, but starting to make those small choices,
Definitely.
right, at little steps at a time, especially if you're making this transition from making a complete 360 lifestyle or 180 lifestyle change, right? So, okay, that's awesome. And so for patients, that are on or that are suffering from high cholesterol, or maybe suffering from some of the comorbidities of high cholesterol, would you say that a lot of these patients are on medications, or do you recommend mostly a lifestyle change for those patients?
Again, first is lifestyle changes. You want to make sure that the lifestyle is as controlled as possible. Can you control your life, really?
Right.
You add children into the mix.
Exactly.
And then everything gets out of control. But you want to optimize.
Okay.
It's probably a better word. You want to optimize your eating habits, your exercise, your activity, for sure. And that's going to be first. Now, once we get that in order, then we can start looking at cholesterol medication, for sure. But it's not my first choice. Again, everyone is different. It really depends on numbers. I don't want anyone with a cholesterol of 300 walking out of my office without medication. But someone who's in the low 200 would be okay with 3 months with a plan.
Right. Awesome. And so let's say for somebody who's already on medication, is it possible for them to kind of start making those lifestyle changes to eventually get off the medication? Or would you recommend that once somebody's on medication, depending on how high their levels are, that they would kind of continue to be on that medication?
Yes, I get my patients ask me all the time, can I get off of my medication?
Yes.
Again, we have to look at the numbers, and everyone is different. So total cholesterol should be less than 200. Let's say I have a patient who's at 265 that I started cholesterol medication on. They brought it down to 195. Great, it's less than 200, but it's only 5 points away from being at a high level, right? And so we discuss, okay, have you continued exercising? Have you continued with healthy eating habits? If they haven't, then we kind of still keep on tweaking their plan, but keep the medication on.
Right.
Another patient, same 265 cholesterol, comes back. They really did what they were supposed to, lost 10% of their body weight in 3 months instead of 6 months. So exercise is there. They're watching what they're eating. They've completely changed, cut out red meat. Now it's more of the lean cuts of meat, more fruits, more vegetables. And and that person, their cholesterol comes down to 130. So 130 is a big change from 265, and well below the 200.
Right.
If I'm confident that they can continue taking care of themselves, I don't stop medication.
Yes.
We go with the option of 1 day yes, 1 day no.
Okay.
All right.
Gotcha.
And then, so 3 months of that. Take it 1 day, rest 1 day, take it another day, rest the next day. So every other day taking medication. If the numbers stay the same 3 months later, or I mean even like 160. But if I see that it's 202, then we know we can't make that change, and we have to keep it every single day.
Right, absolutely. And I'm sure every patient, you know, it's specific. It's a unique case for every patient, right? So it's always best, I'm sure, to make sure that any of our employees that are watching are always consulting with their physicians, if they are in this scenario, to, you know, make sure that their unique case is well taken care of, right?
Definitely.
Awesome. So, talking about patients still, if somebody has a family history of high cholesterol, is that something that a patient would have to, you know, continuously monitor, or generally, if they do live a healthy lifestyle, would that be something that they would still kind of need to worry about? And if they are active and healthy, would that family history of, you know, high cholesterol still kind of be something that they should worry about?
So we've heard all those unfortunate cases of someone who's fit, exercising in the middle of their treadmill run, unfortunately passes away. That's usually due to family history, without knowing their history, of course, if they were seeing their doctor every year, what their numbers were at. But definitely family history takes is a big part of what we have to look at. For instance, I just had a patient last week. He is 43, and he was like, I have 2 children, they're young, I want to be here for my kids. And I'm looking more now at my health. My dad just told me, Dad is 68, my dad just told me that his dad didn't just tell him, right? His dad had a stent placed. Okay. So Dad had a stent placed at 68, also healthy, and he wasn't feeling any symptoms. He just said, you know, I really want to see the doctor, and so this patient's father was proactive, no symptoms, saw a cardiologist because he had high blood pressure. That was his only risk factor, and they were doing a treadmill test. Something funny came out, and they said we need to do a cardiac cath. And at the cardiac cath, they had to place a stent. So this patient tells me, the son is my patient, he tells me I really want to get checked. And so sure enough, cholesterol was elevated. He's young. He needs to. He was also proactive, and we got him on a treatment plan.
Oh wow! Okay.
And again, everyone is tailored. We have to look at each individual patient,
right?
Because so he had family history. Some people don't know their family history, whether they're adopted, they're in foster care, lost track of their family and don't speak to them. Whatever the case is, they come in. And if I get those numbers and I see, again, total cholesterol should be less than 200, if I see a number like 377, I'm getting scared.
Right.
And 377 is almost double what it should be. Those numbers are under a group of cholesterol that's called familial hyperlipidemia. And then under there's several classes. So depending on what's high, what's low, so that's where we're looking at those numbers. For sure.
Awesome. Gotcha. So I guess to kind of round out today's talk about cholesterol, hyperlipidemia, and some of the comorbidities that come from that, What's something that you would, just some general advice that you can give to our employees if they feel that they might have high cholesterol or are currently dealing with high cholesterol?
So everyone should definitely get an annual checkup every year. It doesn't matter your age. It could be 22, you could be 68. The earlier you start getting your annual checkups with blood work, the more we have in our arsenal to help protect you.
Absolutely.
So a 22-year-old who's coming every year to get his cholesterol checked, we can see if it starts going up, then okay, what are you doing different? It happened a lot with the pandemic. People stopped coming to the doctor. People gained weight during the pandemic, 15, 20 pounds, and so they're back. Blood pressure is a little higher, weight is higher, and the numbers are completely different. So, but I had the history from a year and a half, 2 years ago, and so I wouldn't jump to starting medication, which is what we talked about earlier, if I had normal numbers from that patient before. Now, if this is a new patient who's been honest with me and says I gained weight, and then we start, tailoring a treatment plan for them. But definitely an annual checkup. Get your blood work done so that we can catch something before it becomes a problem.
Right, absolutely. Thank you so much for joining us today, Dr. Madrid. I really appreciate all of the insight that you've given us into cholesterol and hyperlipidemia, and we really appreciate you coming out to join the wellness program today.
Thank you so much for inviting me.
Absolutely. Thank you so much to all of our viewers. Please subscribe to our Wellness Program YouTube channel and join us as we continue our Wellness Exchange series and look into many other health and wellness topics.